Stefan Hartman here, Iron DBC. Let's talk about how to use GLP-1 peptides correctly.
GLP-1s and their main side effect, which is weight loss. You may be thinking, hey, that's what I want. Well, these GLP-1s, they will cause you to lose both bone, muscle, and fat. Doesn't sound quite as good now, does it? But I'm not here to tell you not to take it. I'm here to tell you how to best use it under the prescription of someone who understands what they're doing. So you want to be working with likely a nutritionist and a personal trainer. You want to be maximizing your protein intake and understanding how to protein leverage before you start on this medication. And you want a resistance training program. You want to work with a personal trainer to build you a progressive resistance training program so you can build muscle, right? It's what we're trying to prevent from loss here. Because the GLP-1s, they will drastically reduce the amount of calories you can consume per day through its method of delaying gastric emptying and also suppressing ghrelin. So there's both a physical and a psychological component towards why people lose weight on these medications or these peptides. Let's talk about some other ways to prevent the muscle and bone loss. We can use human growth hormone or the peptides, such as CJC ipamorelin, AOD, or tesamorelin, or even MK677, not used as much because that one actually increases appetite. We can also use anabolics. Anabolic steroids like testosterone replacement therapy. Many older adults have lower testosterone, and this may have influenced why they gained weight in the first place due to low muscle mass. Muscle is more metabolically active than fat. Your fat just sits on you. Your muscle requires calories just to sustain itself. So me just standing here with higher muscle mass is burning more calories than someone who has less muscle mass and more fat. So that's why it's key to increase these two first. Other anabolics, a bit more esoteric that I've come across, are oxandrolone and nandrolone. Now, mind you, these were studied in the 1960s and 70s, and they never even heard of GLP-1s back then commonly, right? But we can use old medications and repurpose them for new reasons in the modern day. And one of the biggest reasons I would think about using these would be wasting disorders, because that's where they were studied. They were studied in burn victims and patients with malnutrition, patients with hepatitis, AIDS, and HIV. All of these are severe wasting disorders. Oxandrolone is an orally available anabolic steroid. It doesn't have virilizing side effects, so it's a good candidate for women. It doesn't make you more masculine. It also has low toxicity. This is contrary to popular belief when you think about anabolic steroids. But if you look at some of the studies, oxandrolone was studied in quite severely ill populations, including those with fulminant hepatitis, liver disease. And oxandrolone was shown to actually not have worsening liver side effects and actually improve the survival rates of fulminant hepatitis. Oxandrolone has a very quick peak to anabolic efficacy, so it will peak in about 4 to 5 hours in the blood, and it has 10 times the anabolic activity of something like testosterone. So this would be very convenient to use prior to a workout, prior to your training routine, to maximize its benefit. Nandrolone, on the other hand, is an injectable anabolic steroid. It also has a longer half-life, similar to testosterone cypionate, about 5 to 10 days. It also has been studied in wasting diseases like AIDS and hepatitis. And they're both quite efficacious in preventing bone turnover and muscle loss. So this is kind of my pattern of thinking when we're thinking about using GLP-1 peptides or medications. I'm not here like other health professionals or coaches tell you not to take GLP-1s. I know people are going to take them, and they have been well studied to cause weight loss, which a lot of people need. But I have studied the best way to potentially prevent the weight loss, namely the bone and muscle loss, and help you with the weight loss you want to achieve, which is fat loss. And is what as we discussed just now: protein intake, progressive resistance training, and then looking at the hormones, growth hormone, testosterone, and the anabolic steroids, oxandrolone and nandrolone, which can be used for wasting disorders and to prevent muscle and bone loss. Hopefully that helped you all, and we cleared up A lot of the controversies around GLP-1s and my approach towards my patients here at Iron DPC in helping them optimize, helping them retain their muscle while losing fat, and preventing the main side effect of these GLP-1s. The point being is muscle is medicine. You want to preserve it, and anything we can do to preserve muscle will decrease your risk of a lot of diseases. Anything from falls in the elderly, fractures, to reversing depression, to decreasing cardiovascular disease risk. Muscle influences all of these things, and I feel like muscle is a neglected organ and an endocrine organ in the human body. Look it up. It is an endocrine organ. So hopefully that helped, and stay tuned for more cutting-edge info like this on the Iron Direct Primary Care YouTube channel and Instagram page. Thanks for joining me.